Okay. 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 Yeah. Let's start this presentation. We are looking at healthcare management, and this presentation we want to introduce you to the. We want to introduce you to what we call the healthcare industry. Or basically, you need to understand the landscape of the healthcare industry as healthcare managers or as public health professionals. You should be interested in knowing the landscape of healthcare industry, this industry that you are entering into. Uh, what what are the dynamics in this industry? What are the challenges and opportunities? And what different entities are actually doing in this industry. So that is what we are going to look at. We cannot look at the healthcare industry without first understanding what health is and how health is provided and the components of the healthcare system and the way we can conceptualize the healthcare system to be able to analyze it and understand areas that we can tackle or areas where we can improve. So let's dive into that just in 1 minute. So we usually define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is a definition that all of you know, and it is a definition that was formulated by WHO in 1948. Okay, so it basically recognizes that health has various dimensions. The physical dimension, what we call physical health, mental health, and social health. In all these dimensions, the key emphasis is that uh, one should be in the complete state of well-being. Okay, where their body and body systems are actually working normally, and then that their emotional, psychological, and social well-being is also well catered for. So that is the definition of health. We usually use the concept of social determinants of health to basically illustrate that for diseases to happen, there must have been a number of factors that contribute to these diseases. And these factors come from, or can be categorized at individual level, community level, societal level, even at national level. Okay, so those are the ones we call the determinants of health. We can use that categorization that I've used if you are focusing on what we call the ecological model of health. Okay, still it retains aspects to do with the fact that where where we live, where we work, and the environment around our homes, whether it is the built environment, whether it is the natural environment, all these factors contribute to our well-being or contribute to our state of health. And that's why we call them the determinants of health. Okay? So So these things are the ones that really influence our health. Our genetic makeup, that means that the genetic characteristics that we inherit from our parents, the food that we eat, whether we drink alcohol, whether we drive cars recklessly, whether we are exposed to pollutions, whether we have a very organized healthcare system. All these things will influence our health, and we call them determinants of health. Sometimes we call them socioeconomic determinants of health or social determinants of health. Different words can be used. Basically, the emphasis here is that you have different factors that contribute to the occurrence of diseases. And then we come to the aspect of health indicators. Health is difficult to measure, but at least there are indicators that we use to be able to know the health status of populations or communities. So these are metrics. Basically, they give us the numbers, numeric numbers that we can interpret, that we can compare between different communities, populations, or groups. So they can also allow us to see whether our interventions are actually improving health, because you don't want to be investing resources and you can't measure whether your resources are bringing in the results that you want. So usually, as you will see in subsequent modules, we have what you call mortality indicators and morbidity indicators. Mortality indicators are to do with the number of people who die in a particular population. If we don't look at specific diseases, we say that it's crude mortality rate. If we look at maybe specific diseases or specific population groups, then we can talk about age-specific mortality rates or sex-specific mortality rates, or specific mortality rates in particular races or other groups, as we want. When we talk about morbidity, we talk about people who have a particular illness. So usually we talk about prevalence and incidence as the major indices in morbidity. Okay, and generally, often the commonly used morbidities, of course, can fall into any of those categories, and there were the ones that we have here. Life expectancy, the average number of years a person is expected to live. This is a very good indicator. We can compare the life expectancy of South Sudanese, the life expectancy with the life expectancy of Kenyans or even Ugandans. And then infant mortality rate, the number of infants that die per 1,000 live births. Okay, this is a very good indicator because it is a very sensitive indicator. That means that any change within the health system can result into changes in the infant mortality rate. So that means it becomes a very good indicator for health. Okay, and then maternal mortality rate, number of maternal deaths per 100,000 live births. Disease prevalence, the people who have a particular disease in a particular population at a given time, and then access to healthcare. These are few out of the very many indicators that we can use for assessing the level of health of populations, and also be able to compare them with what other countries have. So healthcare industry, or the healthcare system, or the healthcare sector, okay, it can have a lot of words, and many words to mean the same thing. The healthcare system, the health system, the healthcare industry, the healthcare sector. What this basically means is that we are talking about how people in a particular geographical area access health. Okay, how populations access health. So we look at how the health services are organized, okay, to meet the health needs of these populations. Okay, so we think about who is providing the health services, that is, what institutions, what people, okay, the people, the institutions, and also the resources that are available to make sure that people access the services that they need. That's what we call healthcare system or healthcare industry generally. Okay, how medical care is organized to provide medical services to people of that population. So, of course, the goal of the healthcare sector is to make sure that people have optimal health outcomes. Optimal health outcomes. This is to say that people are able to live as long as possible. That means that diseases are controlled, diseases are treated, or for people who have diseases that have progressed, they are actually rehabilitated. So basically, this is to say that everyone should be living with optimal health. Optimal health is what the healthcare industry tries to achieve. Okay? And then we move to what are the things that make up the healthcare system or the healthcare industry. We already said that we can look at the healthcare system as the people involved in service provision, the institutions, that is the organizations. Are they hospitals? Are they clinics? Are they owned by private people? Are they owned by government? Are they owned by religious institutions? Are they for profit or they are for non-profit making? So we look at the institution, the people, the institutions, and then we look at the resources. Okay, that is the financial resources, the human resources for health, the medical resources, and then also the technological resources that you may need. Okay, but we can also look at the healthcare system as in terms of inputs, outputs, and processes, or how these services are actually provided to people. Okay, so the things that you need to be able to provide healthcare, you need them. They are the ones we call the inputs. You need the human resources. You need the medical supplies. You need the technological equipment, the CT scans, all the diagnostics, information technology system, that is human health information management systems, a lot of things that you need them there. So the medicines, the vaccines, the clouds, everything, those are the inputs. Now the outputs, these are basically the outcomes. Okay, you have people who have been treated, or we have diseases that have been prevented from happening, or you have vaccines that have been developed, or you have the quality of care that has already improved, and a lot of outputs. Okay, and then how these things, the processes of delivering this medical care. Is it in the hospitals, the clinics? Is it in village centers or primary healthcare units or primary healthcare centers? That is the processes. Okay. We can also look at the healthcare system components in terms of what we call the WHO building blocks for health systems, where we have the human resources, that is the human resource, the people who work in the hospitals. We look at the infrastructure, the nature of the healthcare facilities, okay, the hospitals, the primary healthcare centers, the primary healthcare units, and the rest, that is the infrastructure. We look at the medicines, pharmaceuticals, and other supplies needed. Then we look at the governance. We look at governance issues to do with how health sector is actually governed, leadership and governance. And we look at the financial resources. Okay, where do the financial resources come from to run the healthcare industry. Okay, so we can look at the healthcare system using either inputs, outputs, and the processes, or we can use the WHO building block model for health systems. And then we can also look at the provision of healthcare services according to the different levels or according to the nature of services that are being provided. So we can say that the first time you get, let us say, a cough, then you go to see a primary physician or primary healthcare worker. That is what you call primary healthcare. Okay, primary care, basically the first time you interact with the health system. If your condition cannot be handled, you can be referred from a primary healthcare unit or primary healthcare center and go to a hospital. Okay, the hospital provides more services compared to a primary care level facility. Okay, and then of course you have medical, surgical, obstetric, pediatric, all these levels of care. Professionals that can provide this specialized care are available at secondary level. And then if the condition cannot really be managed, then you go to the tertiary one. The tertiary one is where now you have specialized care. Okay, so where you also have ICUs, that is the top, one of the top levels of care. What I've not included here is what you can call quaternary care. This is where someone is actually treated at or using facilities or using medications that are still under research. Okay, you can have drugs or research that is a drug that is still under investigation, but it has high potential to heal certain diseases, and you can have some people eligible for that level of care. That is basically research-based kind of care that is provided at this highly research-based facilities. That is quaternary care. So the industry of healthcare is quite large. If you look at how much money is within the healthcare industry and the future projections, you can really see that it is in billions of US dollars. Okay, and this is likely to increase and increase in the coming years. So that means that the healthcare industry is one that is definitely, by all means, that it's going to increase in terms of growth. Okay, the growth in that industry or this industry is going to be extremely very high. You have a number of players. Okay, this money that you have just seen there, the money that is within the healthcare industry, comes from a number of areas, comes from what patients pay, comes from what governments inject in, comes from what other private organizations actually inject in. So the resources come from governments, public resources, come from private investors, come from philanthropists, okay? The people who want to give philanthropy, actually. Philanthropy, you have a lot of resources that are coming from there. Especially you see that the NGOs that we have, they are running on money that is coming from charities, governments, but also foundations that give money to healthcare industry. Okay, so the healthcare industry has a lot of key players, apart from what we basically know, the clinics, the hospitals, but also the pharmaceutical industry, the technology industry, or the manufacturing industry. The equipment that we use, the devices that we use are coming from the technology, biomedical companies or biotechs. And then you also have insurance organizations, you also have telemedicine, and digital health. That means that in the healthcare industries, you have a lot of areas where you can decide to focus and specialize in your career. And then this therefore means that the healthcare industry is very key to development of the country. We have what we call medical tourism, for example. We have manufacturing of drugs, vaccines, and other equipment. This is very, very, very big. That means that the healthcare industry has the potential to contribute to economic growth of any country. Many people are actually employed within the health sector. So money that is lost to in treating people abroad is actually a lot of money, and that's basically what I'm terming as medical tourism. So that means that governments are deliberately investing in healthcare industry to make sure that they get as many medical tourists as possible. People who go for treatments, these are the ones that are calling as medical tourists. Okay, so the growth in the healthcare sector is going to increase tremendously, and part of this is because people are more aware about health issues. That means that they are willing to spend more on health. People are no longer dying as they are young. That means that aging population is increasing, and often this comes with a lot of chronic conditions that require a lot of financial resources to take care of these chronic conditions. And definitely, increasing technology is going to increase the amount of money that is spent in the healthcare industry. So that means that it is a viable field regardless of where you're talking about, whether it is South Sudan, whether it is another country, whether it is a developing or developed country, healthcare industry is likely to grow. Okay? What are countries spending? We can see that, of course, one of the highest spenders in healthcare industry is the US. Okay, the amount of money that the US government spends on each citizen is the highest actually, as you can see here. Health spending per capita. How much money the government spends on the health of an individual per person, how much is being spent. The US is spending quite high compared to, for example, Germany. You can see Germany is spending 8,000 per person per year. And then if you look at the health indicators, life expectancy, you can see that Germany is spending less, but their people are living longer than people in the US, the Americans. Okay, so there is something to pick up from there, that yes, it is likely that the more you spend financial resources on health industry or healthcare, the more likely you have better health outcomes. But sometimes you can have extremely high expenditures on health, but when you compare with countries that spend less, the countries that spend less, some of them may have better health outcomes than others, and there are very many reasons to advance that point. And then if you look at the East African region, we can see that Kenya, and then Djibouti here, Djibouti $110 per person, and then you have Kenya coming in there, the traditional East African countries. Kenya is doing well, and then you can see that South Sudan is actually is at the bottom, right? This is to basically mean that the amount of money that is spent on healthcare on each South Sudanese is $25 per year. Okay, so what are the global trends? Healthcare has been shifting in terms of how it is delivered, people's thinking towards health, how it is being organized, and things like that. So where are we going to? Okay, we are going to the aspect of value for money. Okay, proper outcomes versus the resources that you use or versus the cost. Patient experience and patient outcomes and key metrics in what we call value-based care. Okay, focusing a lot of resources on preventive medicine or preventive care is now the mainstream, like the main way of doing things. Don't focus on treating, focus on preventing. The use of technology, including digital health solutions, what you call mHealth, technologies in health, AI, and a lot of things. That's the direction. Convenience, patient-centeredness is very, very, very important. And then now, globalization results into healthcare professionals or healthcare services being provided across the globe, of course, using technology. So you can have a patient here talking to a physician, let us say in the US, Canada, or any other place. That is the aspect of telemedicine, but this is contributed by the increase. The increase in technology has resulted into this, and also cross-border interactions have increased. Okay. Okay. So we're going to look at the healthcare service systems. What we are looking at here is to understand that we have different entities within the healthcare industry, or different stakeholders within the healthcare industry. We have the providers of healthcare, and then we have the people who receive the healthcare services, what you can call clients or patients. Okay, so and then the organization of these healthcare providers is of course diverse, like you have seen, clinics, hospitals, research centers, insurance organizations, and a lot. So this is basically to say that the healthcare system has a number of entities. Okay, this is what I want you to understand. We have a number of entities, but these entities often make decisions when one, that the decisions that they make actually can influence how the other agents or the other entities within that system actually also respond. Okay, that is one point that you need to make. So, for example, here we are saying that we have what we call autonomy of entities. Okay, autonomy of entities is that a patient will make their own decision regardless of what the healthcare provider is actually saying. Okay, so independent decision is very important. So by the time the patient makes a particular decision, there are several factors that they might have considered, and these factors, if they are interconnected, they are interrelated. Okay, that is one point that you want to get out of the way. And then we are also saying that entities are self-organizing, meaning that they are exhibiting different behaviors even when facing similar problems. Okay, so different entities react differently. The response to a particular change in the system, that response is not going to be uniform, it's going to be different. Okay, that is what we are referring to. They are self-organizing. Okay, and then interactions. These entities don't live in isolation, they don't work alone. There is interaction. Patients are interacting with the healthcare providers. Healthcare providers are interacting with insurance companies. Insurance companies are interacting with the patients. So you have these interconnections among this them. And then this interconnection can result into what we call loops. Okay? That the behavior of one entity The behavior of patients influences the behavior of healthcare providers. The behavior of healthcare providers influences the behavior of patients. The behavior of patients influences the behavior of insurance companies. So we are having interactions there. And one of the key things in that interaction is what we call information sharing. The patients share information with the providers share information with the healthcare insurance organizations and other entities, including the government authorities, including research. A lot of information sharing is actually happening. So this feedback, what we are calling the feedback loops, this feedback has a way it affects a service provision, the performance of the healthcare industry. Okay? So from that explanation, you can really see that the healthcare industry is quite complex. You don't know what will affect what. You can't predict that. So often we use what we call models to simulate and visualize and be able to explain what might happen if, for example, you introduce a change in the healthcare system. Okay, so that means that as healthcare professionals, you need to be very good at modeling. You need to be very good at predictive modeling. Okay, that is to say, if you increase the number of doctors, what will happen to the patient waiting time, for example, but what will happen to the financials, waiting time, and things like that, is something that you need to be very conversant with. Okay, and for you to be able to build such a model, you need to have a good conceptualization of how the system actually works. So you need to understand what makes up the system, which we often call the components of the system. So you can look at it in terms of the inputs, outputs, processes of what we are calling service providers here. Okay, and then also structuring the different components into different levels or subsystems. We have in hospitals at the top, we have in clinics followed there. How do the insurance companies come in? How do the government agencies come in? You really need to understand the levels at which all these interact. Okay, of course, services cannot be provided in the same way, depending on the nature of the health system, depending on the government regulation, depending on the nature of health services that you're providing. There will always be variations there. Okay, but you can look at healthcare services in terms of the supply of these healthcare services, or in terms of the demand for these healthcare services. And still, this adds to what we have looked at in terms of the input-output processes or service provider model of looking at the health system. Okay, so who is providing the health services, the health personnel? Where are they being provided in the facilities? How much does it cost, and who pays for the cost? That is cost and financing. And then we look at the nature of the service provision. How are services managed? How long does it take to see a doctor? How long does it take to get a transplant, and things like that? Okay, and then the people who receive these services, what is their profile by age, by occupation, by economic status, and also social networks. How do they use these services is something that you also want to know. Okay, so still the same approach of looking at inputs, outputs of the healthcare system. Okay, different layers, different factors will act at different levels to influence the other actor within a particular system. Usually, the entities are not the same. The physicians are not the same as nurses. The nurses are not the same as physicians. You have the laboratory technicians. All these health professions are actually also different from the patients. The patients themselves are different from one another. And that's what we call heterogeneous entities. In the healthcare industry, people are quite different. and they have different profiles, behaviors, characteristics, name it all. Okay? And then how do people make decisions about healthcare service provision? We have a concept that we call bounded rationality. Often, patients will make decisions on whether to visit a health facility A or B, depending on partial information. So it is very rare that you will have full information for you to make a decision. So bounded rationality is in that concept that decisions will not always be made when you have every information at hand, such that you make what you can call an informed decision. Even the physician, when they are giving you treatment, they are not very sure of the performance of the drug when you take it. Okay, so still they have to make a decision on what drug you need to take. It's still an element of uncertainty there. It's often a concept that we call information asymmetry. Okay, information asymmetry, which is very, very common in healthcare industry. The physician or the patients or even the insurance organization don't have complete information about your health, but they still need to make decisions. Okay, we have explained the interactions between the different entities within the healthcare system. That is, if you visualize the healthcare system in terms of a system, and where we have just said that modeling becomes very key. And for you to do that modeling, you need to know how entity A influences entity B. That relationship, what relationship is it? Is it a relationship that influences negatively, or is it a relationship that brings about a positive change? Okay, I already explained that entities make their own decisions based on the information that they have, and then also they adjust their behaviors in response to environmental changes. So that means that as healthcare managers, you really need to be able to think through, get feedback from clients, and know their decision-making processes and the things that you need to improve. That is, if you are going to provide what we call client-centered quality care. Okay. Safe organization is something that I had explained earlier on. This is to say that the entities actually find their own ways of adjusting themselves according to the prevailing situations. Okay, but still, understanding how these systems work is very key, and that's why the complexity theory is still continuing to be used in the healthcare industry to understand the interaction of these components or these entities within the healthcare industry. And also, like I said, statistical modeling, what I termed as predictive modeling, becomes very, very key. And that means that reliance on data in the healthcare industry is very, very important. Okay, so these interactions can be direct or indirect, depending on what you're basically talking about. The patient directly talk directly to a patient, or you can have the entities influencing one another through competition dynamics. Okay, you can have one entity maybe reducing the price, and then another entity will react because the other one has reduced the price, such that they can actually compete out there. So you can have these indirect interaction and also direct interactions. And I've already explained the feedback loops. I will not explain that more. Okay. Lastly, you have understood that the healthcare industry is quite dynamic. It is a growing field. It is likely to continue growing, and that the changes within the healthcare industry will continue to be So as healthcare managers, that means that you need to be very good at providing leadership and also very good at management. Okay, you're going to manage resources, human resources, financial resources.